Good day, Priority Mail family. This is Eric, the Men's Health NP, CEO of Priority Mail LLC, where men's health is the priority. I come to you today because I want to kind of reassure you and be that calming force, voice, and all that you need right now with what's going on with the coronavirus. I want us to not panic, but I want us to prepare because the coronavirus is a serious public health threat right now. And what's happening from a local government standpoint is necessary. And I want everybody to continue to comply with the recommendations. So I thought it would be nice today to maybe go to the CDC, print out what they're saying, and I want to read that to you all and add a little bit of what I know you all need to do. Okay? So, again, coronavirus is here, y'all. It's not going anywhere. If it hasn't affected you, it will be affecting you or someone that you know. And it's coming to a city near you or home near you. Okay, so be mindful of that. We really need to make sure we're staying in our homes. We don't have to go. If you don't have to be out, there's no need for you to be out moving around in the community. Okay, this message is particularly for the people, the young people, with that newfound freedom, energy, resources, and all those things that we all have been there and enjoyed that. You could potentially go out and get the virus and bring it home and harm someone that is dear and near to you. Your mom, your dad, your grandmother, your grandfather. So I want you to think about that. If you don't have to go out, school is out, most of the classes are in some type of telecommunication process right now. And there's no need for you to really be out moving around. And those are the recommendations from the CDC. Okay? So let's talk about some other things here. If you have someone that's high risk in your family, you need to have a room in your home that you're going to isolate them in should they get the virus. Okay? And put them in that room, and just hopefully that room has a restroom as well, where they will have facilities that they can use while they isolate and shelter in place. You need to do a terminal clean. This is straight from the CDC, y'all, and you're welcome to go to the cdc.gov/coronavirus/2019-NCOV to look at this report. And again, I wanted to read it straight from there. You need to do a terminal clean. And what I mean by terminal clean of your home, you need to clean all common touch points. Okay, the front door knobs, all the door knobs, all the light switches, all the water faucets, all the handles, the stove, microwave, refrigerator, dishwasher, all the countertops, all the tables. Do a terminal clean. Get the kids to get out. If they're at home with you, tell them to come out and help. Let's make it a family effort here. But terminally clean your home. To try to get rid of all the things that are there. Get to know your neighbors. Check on your neighbors, especially if you have elderly neighbors. Check on them. See how they're doing. See what they might need. You never know. They are probably suffering in silence. They could be here from another state, from another country, and don't have family. You might be the closest thing to a family they know. Check on them and see how they're doing. See what they need. Reassure them and let them know you're there to help. And we need to band together. Banding together is what it's going to take for us to get ahead and survive this coronavirus. And we're going to do that. We're going to survive. But we got to band together, y'all. Okay? Avoid close contact. Now, yes, right now they're shutting down pretty much everything. So what's pretty much going to be open are going to be fire departments, emergency response teams, hospitals, and a lot of the grocery stores, surprisingly, are going to be open for you to get those necessary things to survive. So if you're thinking that you're not going to be able to do that, that's actually not the case. You are still going to be able to move around and buy the things you need, but make sure you buy enough when you go. You practice the CDC recommendations as far as social distancing is concerning. Cover your cough, wash your hands, and avoid people that are obviously sick. Okay? Disinfect all surfaces. Use hand sanitizer regularly, but nothing beats washing your hands for 20 seconds with an approved soap. Okay, let's see here. This is straight from the CDC, y'all. If you're sick, you have fever, stay home. Unless you're on the front lines, you're an emergency response person, you're a physician, doctor, nurse, respiratory therapist, medical assistant, something in medicine where you are required to go out, or you're an administrative official where you are required to be somewhere to represent your organization, if you don't have to go out and you can do this via telework or some type of telecommunication, please do so. Okay? We really need to make sure we're complying with that piece of it. All right? Let's see here. Almost done. Almost done. Just want to reassure you all. We're gonna get past this, y'all. I envision one day when the corona is run its course, we're gonna be able to have a virtual corona together, and maybe laugh about some of the things that have happened during this corona apocalypse here. So. Take care of your kids. Try to keep them busy. Try to keep them engaged. Now, if you don't know, the kids can potentially harbor the virus as well. And again, they're pretty healthy, so they'll probably do fine. But if your kids are being kept by your grandparents and they've had some interaction or come in contact potentially with the virus, it could potentially harm your parents. So let's be mindful of that. So let's make sure to again, we're taking good care of our family, watching the kids very closely, making sure they're not having fever, chills. And then if they need to get the care they need, take them to the emergency room. But I want to say this about going to the emergency room. The recommendations now are, if you are sick and you have mild symptoms, to shelter in place. Stay home, push fluids, get rest, diet is tolerated, activity is tolerated, but isolate yourself. Okay? However, if you were to have worsening of the chest pain, shortness of breath, if you were to cough up blood-tinged sputum and your fever is not responding to your conservative measures of Tylenol, Motrin, fluids, and the like, then and only then are you to go to the emergency room and let them do the appropriate triage to determine if you have a social, occupational, or recent travel exposure that could have potentially put you at risk for the coronavirus. And then they'll test you accordingly. Outside of that, if you're just worried about it and you have symptoms suggestive of possibly a viral illness, which we're in a viral season. This is still seasonal flu season. Okay, so you could potentially have the seasonal flu. So there's really no need to run to the emergency room right now. Our system cannot take the surge of people that think they need to come and really don't need to come because they only have mild symptoms. Let's really save the emergency room time for those people that really have underlying conditions that need to be there. And it's more than likely going to be our elderly, our infirm, and those with chronic conditions that are not managed well, or they just have chronic conditions that place them at higher risk. Okay. Outside of that, again, I want to put you all at ease. This coronavirus is here to stay. It's not going anywhere. Our leaders are doing all that they can to keep us at ease, to implement government structures and things of that nature that will provide us with the things we need to manage this storm. And we're going to get through this. We have to band together. Okay, band together, look out for one another, and let's keep a safe distance right now until this blows over, and then we'll be able to pick up where we left off here very shortly. Here at my facility, I'm having to wear this mask all day because of the situation we have here. And again, I'm on the front line, so hey, it comes with the territory. I salute all the healthcare professionals that are still going in and doing what they need to do to take care of patients and change lives and save lives in the process. I salute you, my brothers and sisters. Thank you for what you do. Now, sometimes this is a thankless job, but we love what we do. I wouldn't change it for anything in the world. And I want to, again, reassure you all, let you know that I'm here to answer questions. I want to be that calming voice, that resource that you can come to and know that this is going to be okay. But I know you're feeling panicked, but let's not panic. Let's prepare. There's a difference. It's okay to panic, but we got to now take a deep breath, step back, and look at this for what it is, and let's prepare. All right? We're going to be okay. We are going to be okay. And I'm going to keep coming to you, letting you know if there's anything that we need to do differently. But right now, y'all, I'm encouraging you all, unless you really have to go out, don't go out. Stay home, especially if you're sick. If you can afford to do so, stay home. Take care of your families. Take care of yourself. I love y'all. I want to keep you up to date. If you have questions, feel free to DM me, and I will get back to you at my earliest convenience. I pray for everyone here that are following me, And I pray for all of our first responders, all of the healthcare professionals that are out there on a daily basis doing what they do to save lives. Thank you all, and may God continue to bless you. Stay tuned, y'all. We'll be in touch. Cover your cough, wash your hands. Have a wonderful day. Peace.